board, and welcome everyone to today's Reach Out and Read webinar, Strategies for Building Emotional and Behavioral Regulation. I'd like to give a warm welcome to our presenter, Dr. Matthew Jandrisevits. Sorry, we talked about it beforehand and I still couldn't get it out. We'll be discussing ways providers can support and guide parents and caregivers in building emotional and behavioral regulation with their children. He'll also share a little bit about the Wisconsin Child Psychiatry Consultation Program and the services they provide. Before we get started, I'd like to just go over a few housekeeping items. All participants will be muted upon entry. Please use the chat box throughout the presentation to ask any questions or add comments. As Dr. Jandrisevits is speaking, at the end of the presentation, I will read aloud any questions, and this webinar is being recorded and will be posted to our Reach Out and Read YouTube page for you to view later or share with colleagues. And you will receive a survey and some additional resources following the presentation. And with that, I will turn things over to you, Dr. Matt.
Thank you so much, Amber. And good afternoon, everyone. Thank you for attending this webinar, Strategies for Building Emotional or Behavioral Regulation. I'm Matt Jandrisevits, a psychologist at the Medical College of Wisconsin, as well as the behavioral health specialist within the Wisconsin Child Psychiatry Consultation Program, or Wisconsin CPCP, which is a resource for primary care providers to provide kind of email or telephone consultation regarding mental health and behavioral health issues that come through the primary care office. So I'm going to be talking regarding strategies about emotional and behavioral regulation. I don't have any conflict of interest to report in this presentation. The objectives are to review very quickly the effects of stress on increasing rates of mental health concerns in youth, to identify some strategies to offer youth and families when pediatric mental health issues present in primary care, and then to develop an awareness of resources available to support primary care providers to address the mental and behavioral health needs of youth and families. And that does include the very powerful effects of including reading and reading time into the daily routine of kids and families. With that, I'm going to start with a tip of the cap to Reach Out and Read and the fantastic work that you're doing with kids and caregivers. So we'll talk more about how to integrate that into an overall care plan. Some statistics quickly, epidemiology. 17% of kids aged 2 through 8, so we're focusing here on little kids, 70% of children aged 2 through 8 have a diagnosed mental or behavioral health condition. That doesn't include the number of kids who are undiagnosed but have significant mental and behavioral health concerns, nor does this include the number of kids who have subclinical, though kind of functionally significant or concerning mood or behavioral health concerns. So it's pretty frequent, as we all know, and this group is particularly relevant for primary care-based mental and behavioral health screening and early intervention. The reason why this is so important is because, of course, early screening, early intervention can head off more significant mood and behavioral health concerns as kids grow up. We know that depression, anxiety is increasing among kids in the United States. 4.4 million youth in the US aged 3 to 17 are diagnosed with anxiety. 1.9 million are diagnosed with depression. Again, that doesn't take into account those kids who have subclinical struggles that nevertheless need to be attended to. This just depicts graphically what we saw already before the pandemic. We saw that there was a significant number of kids, including even young kids. You see 3 to 5 year old young kids with depression, anxiety, behavioral disorders, and then that will continue to present in increasing numbers as kids age. And so one of the questions is, how do we help kids and families to build really strong coping skills, emotional behavioral regulation skills early, so that as stressors continue to become more complicated as they grow up, they'll be able to manage them effectively. And one more point to make is that, unfortunately, as we all know, suicide rates in youth have been increasing over the past 20 years. These two graphics depict a couple of public health issues, homicide and suicide, and we see that homicide, thankfully, is either steady or slightly decreasing among kids aged 10 to 14 and 15 to 19. But unfortunately, that's not the case for suicide. We're seeing increased rates of suicide, even in younger kids aged 10 to 14. And so it's really incumbent upon all of us to consider early screening and ways of integrating emotional and behavioral health interventions into our overall conceptualization of healthcare. Over the past couple of years, and more specifically during the pandemic, I think we're all keenly aware of patients and families who are presenting with more stress and greater mood and behavioral health concerns. We saw an increase overall in the rate of mental health symptoms in youth over the course of the past couple of years. But as mood and behavioral health concerns have increased in kids, the rate at which kids are receiving mental health, formal mental health services has decreased. And so what that means is that primary care providers are really left to address the gap between the need and the intervention. We know that 60% of psychiatric medications are prescribed by primary care providers, and many PCPs report feeling undertrained to provide mental health care, even as they recognize that it is important to address mental health concerns within the context of the primary care visit. And so the question here is, how can we help promote mental and behavioral health for families during the primary care visit, and to help primary care providers to feel supported in that endeavor? And so this talk is hopefully one avenue to assist with that. We're going to talk a little bit about how to address these issues with particularly younger kids, which might be more relevant to the population that you work with. But what this sort of chart depicts is that over the past couple of years, we've seen an increase clinically in mood and behavioral health concerns across the sort of the developmental span within childhood. And we've also seen, not surprisingly, that parents and caregivers, families are more overwhelmed and are presenting with their own increased stress and mood and behavioral health concerns. And of course, as caregiving systems become more stressed, that's not going to help with the overall stress and mental and behavioral health functioning within the household. And so what that also means is that even within the context of pediatric primary care, there is a role for us to attend to the mental and behavioral well-being of caregivers and families. So when we are talking with parents, grandparents, and others to address mood and behavioral health concerns, maybe in the context of like an acute issue that presents within this particular visit, what can we tell them? How can we guide families in a way that's going to help to kind of break down what is often an overwhelming issue or problem into a conceptualization that might be kind of more easily digested, and that we can take a large problem and kind of break it down into some nuts and bolts strategies that can then be relevant for kids and families during their day-to-day experiences. And so how I like to think about this when I'm communicating with families clinically who present for therapy is, in order to address emotions and behavior, we first have to think about the brain. And if we can think about it in those terms, we can start to match specific interventions and rationale for those interventions into I usually identify one of three parts of the brain that all kind of will work together to help build emotional and behavioral regulation, particularly during stressful situations. And so this schematic here provides sort of an overview of the HPA axis and its response to stress. They're on the left, so that's the physio side of it. I'm not going to really focus too much on that. I want to focus attention more on the right and the three kind of functional elements of the brain that are implicated in the stress response. And that's the amygdala, responsible for emotional regulation and reactivity. The prefrontal cortex, which is responsible for attention, concentration, and focus, and the hippocampus, which is responsible in large part for learning and memory. And so the idea here is that for all kids, but particularly for young kids who have not developed their prefrontal cortex, how can we help strengthen sort of the amygdala or keep the amygdala as regulated as possible so that we can open up space for kids to at least receive confidence-inspiring language and to start to experience sort of a problem-solving approach to be able to effectively manage frustration or disappointment, okay? And in that interaction with a caregiver, how can kids, caregivers, and the dyad experience these challenges, these frustrations and disappointments in a new way, in a more regulated way, so that the next time around, there's a kind of a new learning map that's set up between kid and caregiver, even at a very early age, that even though this situation might not be exactly how the child wants it, it's going to be okay. And there is language that they can eventually use to communicate. The caregiver is going to understand them, and together they're going to work this through. And so we're going to talk about how we can sort of give a roadmap to caregivers of young kids. And eventually we can even start to talk with to children themselves about this. How do we engage families in that process? It's first important, I believe, to normalize it. Tantrums are a common experience, of course, as are the stressors that families face, particularly over the last few years. Caregivers themselves will come often into these conversations from a place of feeling either somewhat incompetent or judge themselves within their caregiving arena. And they come from a vulnerable place, and it's important for us to be able to join with them and to help empower them as they're able to assist with their kids to help their kids develop coping skills to manage situations. So we normalize those issues and stressors. We want to decrease the stigma when talking about mood and behavioral regulation. That's why I want to frame it in terms of what's going on in the brain developmentally. And then we want to identify specific goals with caregivers and with kids as we join with the goals of the caregiving system. It's more likely that we're going to see buy-in and that there's going to be a positive outcome. And then we can discuss potential options for intervention and potential benefits associated with those interventions. So we provided an overview of behavioral relaxation, thought shifting strategies, et cetera, that help caregivers to feel like they've got a handhold or foothold with this particular situation. We want to help them to feel more self-efficacious or more confident in their ability to manage their kids' mood and behavior. That's rewarding in and of itself, and then that's going to yield eventual second order positive outcomes. So a framework for resilience then would be to really address those three parts of the brain. So we want to help caregivers to assist their kids with managing emotions. So that's going to work on the amygdala or the downstairs brain. We want to build positive social interactions. We want kids and caregivers to be able to learn that they're able to do this together in a warm and caring and positive way. And then we want to help kids and caregivers to be able to build an orientation of positive or efficacious self-talk. And so we'll go through each of those in turn. So for managing emotions, that's where we want to recommend calming or self-regulation strategies that caregivers can participate in with their kids. And one of the things that I will even do is I will shift in how I communicate with caregivers as a model for this. As you might tell right here, as you can tell, I'm really sort of trying to pack a lot of information into the context of a 25-minute talk, leaving 5 minutes for questions. So I'm going pretty quickly. The intensity is pretty high. And so sometimes we can see that and feel it in the context of our appointment with a family. And so what I will even do in therapy, when I talk about managing emotions and general relaxation strategies, is I will shift in the way that I interact with the family to slow things down. And we see that just by shifting the way that we talk and interact, the way that we're able to regulate our breathing, it's going to have a powerful effect on our physiology and, in turn, on the physiology of the kids that we're working with. Sometimes this is enough to even help give space for caregivers to be able to think through the situation. Because one thing that is so compelling here is that when the emotion center is overactivated and the amygdala is really what I call blowing up or exploding, it literally turns off our ability to think through situations. It turns off the or greatly diminishes the efficiency of the prefrontal cortex. And so if we're able to help guide caregivers to slow down their own physiology and allow their own kids to be able to kind of melt into them, then it opens up space for caregivers to be able to think through and then respond appropriately and effectively to work through the situation. And so now that we're in that state with the kids, how do we build the positive interactions with kids, particularly young kids who are pre-verbal or who struggle with language? And it turns out that when we're able to attune and provide feedback to kids that we kind of get and understand where they're coming from, and we're able to provide and name the emotion for them, kids' behavior will become more regulated. Particularly, and we know this, particularly with when we're working with pre-verbal kids or kids who struggle with language, they communicate through their actions. And if they feel like they're not understood, they're going to shout, but they're going to shout through their behaviors. And oftentimes that results in a mood and behavioral escalation that will result in a disciplinary action from a caregiver or corrective action, where we have this opportunity for a caregiver to provide a name to the apparent feeling that is being communicated through the behavior. And so when we name those feeling states, that's known as attunement. And this comes from what's known as the attachment, self-regulation, and competency, or ARC framework, for addressing trauma and adverse experiences within a family context. And so an example of this would be for the caregiver to be able to communicate to the child, you're mad right now, I hear you, I get it. I don't like it when things don't work out for me either. But we're gonna figure this out and we can get through this together. Come on, show me, mama, daddy's got you, etc. Okay? And so, this then provides the opportunity for kids and caregivers to relate differently around the challenge at hand. They're able to come together, which is going to have positive impact on the attachment between the kid and the caregiver. And then it allows space for the caregiver then to utilize and model positive self-talk, to be able to think through and then talk through situations and ultimately work through situations in effective ways with kids. And so that's where we kind of take a page out of like parent-child interaction training, or PCIT, where we help caregivers to offer specific labeled praise to the kid in response to behaviors that are effective and appropriate and desirable. Something to the extent of, I know this is frustrating that toy doesn't fit right, or those Legos don't go together, but I like the way that you're staying calm right now. I like how you're sitting with it. I'm going to help you through it. We're going to work through this together. Okay. Sometimes it can be helpful for caregivers when calling kids over or engaging kids in problem solving to clearly identify to kids that they're not in trouble. So there's a crash from the other room, a parent or grandparent comes in. The children were usually socialized when we see a parent come in or a caregiver to sort of assume that we're in trouble. And so that's going to heighten emotional arousal for kids. And so as caregivers are able to say, look, you're not in trouble. Come over here with me. We're going to figure this out together. And then we may even have to go to a low stimuli location in order to help just sort of calm things down, decrease the temperature in the room, and work through it from there. So it turns out that one avenue to engage kids with this would be reading. And that's something that your organization does a fantastic job of. And these are pictures that are really warm. They identify a lot of really good attunement and attachment. The research shows that not only is this good for the development of mood and behavior regulation, social emotional skills in kids, empathy in kids, problem solving in kids, but it actually has positive effects on the caregiver's own physiology, as well as the caregiver's perceived positive relationships with their kids. And so when we think about some clinical examples, for example, we got a 2-year-old that won't separate at daycare and has a lot of irritability and separation anxiety. We want to take a page out of behavioral theory, which suggests that we want to gradually increase the exposure to the separation in a safe way. And so that might include within the home environment. We can start with the kid playing in one room, and then the caregiver starts with the child and then spends gradually increased amount of time in another room. There could be a quick and supportive or playful goodbye routine that kids and caregivers can have, including the use of a transitional object that kids can take with them to daycare. So a stuffed bear, blanket, or a parent's shirt. Storybooks and playful activities, such as, for example, The Kissing Hand by Audrey Penn, which caregivers can read with kids to work through anxieties of all types. And then you can also play this out using dolls or stuffed toys. Similar strategy for a 5-year-old who won't sleep in their own bed and is identifying nightmares. We will have a tangible comfort item, a nice bedtime routine. There could be a nightlight that can be helpful, but then storybooks such as Wilson the Wombat to address nighttime worries and help kids and caregivers to feel like the child to feel safe as they sleep into their own bed, and then we can gradually separate the caregiver from the child. They may start the bedtime routine in the child's bed, but then gradually sort of move away from the kid. And one thing to point out would be the importance of if the kid does go into the caregiver's bed, to walk the child back into their bed and sort of re-implement the bedtime routine in the child's room as opposed to in the caregiver's room. And we want to also provide some resources to address caregiving stress. There are some formal resources such as Wisconsin Family Ties, Facets, Parent to Parent, but there are also book titles and links from, for example, the Child Mind Institute, healthychildren.org, which is kind of you may know, is the family resource from the American Academy of Pediatrics. The National Child Traumatic Stress Network has some nice resources for families as well. And there are a number of books for caregivers to orient them in the strategies that we talked about today, as you see there. And then also there are some storybooks that were specifically written to address mood and behavioral regulation skills and the development of those skills between kids and caregivers. I have included all these in kind of that tip sheet that I emailed to Amber, who will be able to distribute this. I do want to identify one additional resource very quickly for primary care providers, as we do recognize that there's a shortage of formal mental health professionals. We want to be able to help primary care providers address these issues within the context of the primary care visit. So the Wisconsin CPCP was developed for that purpose. We provide consultative support to primary care providers via email or phone. We provide resource support for pediatric patients to other mental health professionals and community resources. We also have a slate of online education modules regarding depression, anxiety, prescription of medications, and others, including mood and behavioral regulation and trauma. We're statewide. We're not an emergency service, but we do, and we don't, we're very cognizant of respecting confidentiality. So we actually don't provide co-management, and we don't, we request that you don't offer identifying information, but we do answer questions regarding the presenting issues on the left and then reasons for consultation on the right. We've been just over the past year, we've provided thousands of consults and providers with a really high success rate. So in summary, mental health needs in youth have increased over the last decade. This is particularly relevant for families who are undergoing stress, particularly those with younger kids. How do we address mood and behavioral health concerns, particularly in young kids? There are strategies to address emotion regulation, the relationship between kids and caregivers, and thinking through these situations. And then we also have support for primary care providers if need be. And if you are interested in learning more about the Wisconsin CPCP, we are at wicpcp.org. Thank you for your attention to this, and I'll take questions and comments briefly.
Thank you, Dr. Jandrisevits. I would just open up this time. If anyone does have any questions in the chat, we have time for about 1 or 2 questions. So we have a question here in the chat. Are there special considerations that should be thought about when working with an adopted child and their family?
Oh my goodness, yes. That's its own talk. But briefly is to recognize that that a trauma-informed approach is necessary. And so when we think about the adverse childhood event study, then we know that there are already multiple adverse childhood events that may have that the child has experienced that have implications for their emotion and behavior regulation. And so to really coach adoptive caregivers to attune to those kids' emotional reactions, and to provide that real base of safety and security and of this communication that they in fact are going to be able to work with the kid and to be able to manage this together.
One more question. What are common questions the CPCP receive from providers on children who are younger than the age of 6, like within the reach out and read?
Sure, right. Yeah, so that's a great question. So a lot of these will be behaviorally based. There are some questions about, well, when might be, what age is too young to start a stimulant for ADHD, for example. But there's a lot of discussion about how do I work with a family who is in which the kid has an increase in the number of explosive tantrums, at daycare, hitting, kicking, biting, oppositional behavior, a lot of anxiety and fear, separation anxiety. The nighttime issue is one that's come through on a number of occasions. Then there's also questions about, how do we, help talk to kids about separation within the family. We're going through a divorce. There have been questions regarding how to talk about death with kids, et cetera. The start of a school year, how to address trauma. So there's a number of more behaviorally based questions, and those are usually they go to me as the behavioral health specialist. I will say that we do have some medication related questions for younger kiddos too. We also have some questions regarding screening tools and screening procedures for young kids.
Again, thank you, Dr. Jandrisevits, for sharing today and um, sharing about the CPCP and how our providers can utilize that resource as well. So if there are any additional questions, I would just encourage to send them along to me, and I can pass them along to Dr. Matt. And I will also be sharing the resources that he talked about today that with anyone who's on the call. So again, thank you, and thank you everyone for joining.
Thank you. Take care.